Hello, my friends. This is Energy and Health, and today we'll talk about something that truly concerns everyone. Every day, millions of people measure their blood pressure, some in the morning, others before bed. We often focus on those numbers on the monitor, but few realize which kind of pressure is actually the most dangerous. Today you'll learn what pulse pressure is, why it can become the silent enemy of your heart, and what early warning signs your body gives when it needs help. Stay with me until the end, because at the end of this video, you'll find out how to detect these dangerous changes in time and protect yourself from stroke, heart attack, and heart failure.
What is blood pressure? Your blood pressure monitor always shows three numbers. Let's break them down. 1. Systolic pressure, the upper number. This is the pressure in your arteries when your heart contracts and pumps blood out. 2. Diastolic pressure, the lower number. This is the pressure when your heart relaxes between beats. 3. Pulse rate, how many times your heart beats per minute. Now, the difference between the upper and lower numbers is called pulse pressure. It's not just a statistic, it's a key indicator of your heart and vascular health, and very often it reveals hidden but extremely dangerous processes inside your body.
Why pulse pressure matters. The formula is simple. Pulse pressure equals systolic minus diastolic. Normal range is 40 to 50 millimeters of mercury. Above 60 millimeters of mercury is a red flag. This means a higher risk of heart attack and stroke. Below 30 millimeters of mercury, your heart isn't pumping strongly enough to deliver oxygen to vital organs. So remember, it's not just high blood pressure that's dangerous, it's the complications that come from it. Chronic changes in pulse pressure are a serious sign that your heart or blood vessels are under stress.
Why pulse pressure increases. Loss of vascular elasticity. As we age, or because of poor lifestyle habits, our artery walls become stiff and less flexible. This happens due to atherosclerosis, cholesterol buildup, and calcium deposits. As a result, the upper pressure rises, the lower pressure drops, and the difference between them grows dangerously large. For example, 120/60 or 110/50. This already means a high risk of stroke or heart attack. What to do? Change your lifestyle. Walk daily, swim, cycle, move your body. Quit smoking and alcohol. Ask your doctor about medications that improve vascular elasticity, such as calcium channel blockers or mild diuretics. Aortic valve insufficiency. The aortic valve is like a door between your heart's left chamber and the main artery, the aorta. It should open one way and prevent blood from flowing back. If this valve becomes weak and allows blood to leak back into the heart, your pulse pressure can shoot up to 70 to 80 millimeters of mercury. This is very dangerous. It can lead to heart failure, arrhythmia, stroke, or sudden collapse. Diagnosis requires a cardiologist exam and echocardiography, or heart ultrasound. Mild cases can be treated with medication. Severe cases may require aortic valve replacement surgery, either open or minimally invasive. Overactive thyroid, or hyperthyroidism. When your thyroid produces too many hormones, your metabolism speeds up, the heart works faster, the upper pressure rises, and the lower one drops, resulting in high pulse pressure. Anemia. When hemoglobin is low, your blood carries less oxygen. Your heart beats faster to compensate, but the vessels don't adapt, so pulse pressure increases again.
When pulse pressure is too low, if your pulse pressure is below 30 millimeters of mercury, that's also dangerous. 1. Muscle failure.
the heart's pumping power weakens. It can't push blood out effectively, and pressure doesn't drop properly during relaxation. This often happens as a result of long-term hypertension or ischemic heart disease. 2. Aortic valve stenosis. Here, the valve is too stiff and doesn't open fully. Blood can't flow properly into the aorta, so the upper pressure stays low while the lower remains high. For example, 120 by 100 or 130 by 110. This condition also requires medical attention and echocardiography.
When does hypertension become a diagnosis? Hypertension isn't just a single high reading. It's when blood pressure stays elevated over time. Doctors use a special device called 24-hour ambulatory blood pressure monitor, or SMAD in Russian. If your average daily pressure is above 130 over 80 millimeters per mercury, you're diagnosed with hypertension. If pressure rises only occasionally, it's often due to stress or fatigue. In that case, the goal is not just to lower the numbers, but to find and fix the root cause.
How to treat and control blood pressure. 1. Find the cause. Visit your cardiologist. Do ECG, echocardiogram, and lab tests. 2. Adjust your lifestyle. Regular exercise, balanced diet, good sleep. 3. Quit smoking and alcohol completely. 4. Reduce salt, caffeine, and maintain healthy weight. 5. Measure pressure on both arms, morning and evening. 6. Follow your doctor's medication plan consistently.
The most dangerous blood pressure is the one you don't feel. It can quietly damage your arteries, heart, and brain for years, until one day it leads to a stroke or heart attack. So, check your pressure at least once a week. Monitor your pulse pressure, and never ignore even small changes. Your awareness could literally save your life. Stay healthy, strong, and full of energy. Heart.
If this video was helpful, please like, subscribe, and share it with someone who needs natural healing and relaxation.